Okay. So and this is not necessarily recent, but definitely something I harp for my surgical candidates and patients such as that, especially those of color, is expectations when it comes to the post-op period. Uh, Dr. McKinney did mention, you want to have a good idea and knowing, who's a good surgical candidate, who's not. These are, of course, things you want to keep in mind, but you really want to have that discussion with the patient and letting them know, listen, these are expectations, and this is a big thing. I'm sure we all have gotten it. Doc, when can I start driving? When
Mhm.
can I start, putting weight on my foot? Things such as that nature. And I have to remind them, listen, we talked about it. These are expectations. These are things that you really have to consider to get the best outcome. Because and I like to tell my patients, when it comes to the recovery, you want to do it once and you want to do it right.
That's
So
right.
yeah, we don't want to
Don't
no
act
one.
up and call us on an
Yes.
emergency phone after hours because you decided you need to go to the mall because there
That's
was a
right.
sale. Don't do that. We love
It,
Right.
you,
Right.
but don't do that.
it
Right.
happens. It definitely happens.
Yeah.
They'll make a decision,
Yeah,
and
make a
this
decision.
is that. So definitely the importance of knowing, and when it comes to that, particularly my patients of color, they have a tendency, as you said before, when you said your grandmother says this and that. In the South, especially here in Eastern North Carolina, we have a tendency to rely heavily on home remedies and what such and such said
Don't worry,
generations.
West Indian people do it, the Africans do it, the
Hmm.
Latinos do it. I hear
Yeah,
it all.
it runs deep here. So I do have to remind them. I was like, you know what? No disrespect to your ancestors and whoever said what, but if you could follow this protocol, I think we'll work out a little bit better.